Did you know that an itch in certain parts of your body after 60 could be an early sign of a life-threatening condition? Ignore them and you might be cutting years off your life. You've always heard that aging comes with aches and pains, but no one talks about the itching. No one tells you that the tingling, the dryness, the irritation in certain areas could be your body screaming for help. And what happens if you ignore it? What if you let it go unchecked for weeks, months, even years? You might be missing the only sign your body is giving you that something is seriously wrong. Doctors know this. Medical experts warn about it. But most people don't take it seriously until it's too late. Some of these warning signs start small: an annoying itch on your hands, a little discomfort on your back, maybe a strange sensation on your feet. But what if I told you that one of these common itchy spots could be linked to deadly diseases? Conditions like liver failure, diabetes, even certain types of cancer. And yet, most seniors dismiss it as dry skin or allergies. They wait, and by the time they realize what's happening, the damage is done. In this video, we're going to expose the truth about 5 itchy spots on your body after 60 that you cannot afford to ignore. The last one is the most dangerous, and shockingly, it's the one most people brush off as nothing. But before we get there, you need to know exactly what's happening inside your body when these itches appear. Because if you catch them early, you might just save yourself years, maybe even decades of health and longevity. So stay with me. Pay close attention. Because what you're about to learn could make the difference between catching a life-threatening disease in time or realizing it when it's too late. And trust me, you don't want to wait until it's too late. Itchy spot number 1, scalp. You wake up in the morning, stretch, and rub your head. Just a little itch, nothing to worry about. Maybe it's just dry skin, maybe the weather's changing, or maybe it's that new shampoo you started using. But what if it isn't? What if that persistent itch on your scalp is more than just a minor irritation? What if it's your body trying to tell you something important? Something you shouldn't ignore? Think about it. When was the last time you really paid attention to your scalp? You probably don't check it in the mirror every day. It's out of sight, out of mind. But here's the problem. That's exactly why dangerous conditions go unnoticed for so long. And by the time symptoms become too severe to ignore, the underlying issue has already progressed. Let's start with one of the most common causes, seborrheic dermatitis. You might know it as dandruff, but in older adults it can be much more than that. Red, flaky patches, persistent itching, even a greasy or yellowish appearance. It's caused by an overgrowth of a yeast-like fungus that feeds on the oils your scalp produces. And if left untreated, it can spread, leading to inflammation, infection, and severe discomfort. But here's where things get even more serious. Chronic scalp itching can be an early sign of psoriasis, an autoimmune disorder that doesn't just affect your skin. Psoriasis is linked to higher risks of heart disease, diabetes, and even certain types of cancer. It's not just about an itchy head, it's about what's happening inside your body. And if you have diabetes, that itching might be a sign that your nerves are being damaged, a condition called diabetic neuropathy. If your scalp is constantly irritated and you're also feeling tingling or numbness elsewhere, especially in your feet or hands, it's time to take action. Margaret, a 68-year-old retired teacher, thought her scalp itch was nothing. She tried different shampoos, even switched to an all-natural hairbrush, but nothing helped. Then she started noticing scabs forming. At first, she thought she had scratched too hard in her sleep. But then the patches spread. The skin became inflamed, sensitive to the touch. When she finally saw a dermatologist, she was diagnosed with an autoimmune disorder that had gone undetected for years. The doctor told her that if she had come in sooner, she could have started treatment earlier before the condition became so severe. So what can you do? First, if your scalp itch is persistent, if you notice redness, flaking, or swelling, don't ignore it. If it's mild, try medicated shampoos with ingredients like ketoconazole, zinc pyrithione, or selenium sulfide. These help fight fungal overgrowth and calm inflammation. But if the itching doesn't go away, or if you notice scabs, sores, or hair loss, it's time to see a doctor. A dermatologist can run tests, check for underlying conditions, and get you the right treatment before things get worse. And remember, your scalp is connected to your overall health. A healthy diet, rich in omega-3 fatty acids, can reduce inflammation. Managing stress through relaxation techniques can also make a huge difference. since stress is a major trigger for autoimmune flare-ups. Have you ever dealt with an itchy scalp that just wouldn't go away? Did you find a solution? Or are you still struggling? Share your experience in the comments. I'd love to hear what's worked for you. And if you're finding this information helpful so far, don't forget to hit that like button. It helps spread awareness to more people who need it. Itchy spot number 2, hands and fingers. You reach out to grab a cup of coffee, and there it is again, that annoying itch on your hands. Maybe it's just dry skin. Maybe the weather is to blame. You put on some lotion, rub your hands together, and move on with your day. But then, a few hours later, the itch is back. This time it's worse. Maybe it even burns. You scratch, but it doesn't help. And if you look closely, you notice something else. Tiny cracks in your skin, redness, maybe even small blisters forming. At first, you think it's just irritation from washing your hands too much. But what if it's more than that? What if your body is trying to tell you something important? Something that could be affecting more than just your skin? One of the most common culprits behind itchy hands is eczema, also known as dermatitis. It can be triggered by allergens, harsh soaps, or even changes in the environment. And for older adults, skin naturally becomes thinner and more prone to irritation. But here's the thing. If the itching on your hands is accompanied by swelling, peeling, or a burning sensation, it could be a sign of something deeper. A reaction happening inside your body, not just on the surface. Now, let's talk about something much more serious, peripheral neuropathy. This is nerve damage caused by diabetes, and it often starts with tingling, itching, or numbness in the hands and fingers. Over time, it can progress to sharp pain, weakness, and even loss of feeling. Imagine trying to button your shirt, hold a spoon, or grip a steering wheel only to realize your hands aren't responding the way they used to. It's terrifying. And what's worse? Many people ignore the early warning signs until the damage is irreversible. Then there's your liver, an organ you probably don't think about often, but one that controls so much of your body's health. When your liver isn't functioning properly, toxins build up in your bloodstream. One of the first signs? Unexplained itching, especially on the palms of your hands and the soles of your feet. Liver disease is often called a silent killer because it progresses slowly without obvious symptoms until it's too late. If you've noticed persistent itching along with fatigue, yellowing of the skin or eyes, or dark-colored urine, it's time to see a doctor. This happened to Robert, a 72-year-old former construction worker. He had been dealing with itchy hands for months. At first, he thought it was just dryness from years of working with his hands. He tried lotions, changed his soap, but nothing helped. Then he started experiencing a strange burning sensation in his fingers. His grip felt weaker. When he finally saw his doctor, tests revealed he had undiagnosed type 2 diabetes, and the itching was an early sign of nerve damage. If he had waited any longer, he could have lost feeling in his hands completely. So, what can you do? First, if your hands are constantly itchy, cracked, or irritated, start with a good moisturizer. Look for one with ceramides or colloidal oatmeal to repair the skin barrier. Avoid harsh soaps and detergents. Opt for fragrance-free, hypoallergenic products instead. But if the itching is accompanied by tingling, burning, or numbness, don't ignore it. Get your blood sugar levels checked. Make sure your diet is supporting your nerve health. Foods rich in B vitamins, omega-3 fatty acids, and antioxidants can help protect your nerves from further damage. If you suspect liver issues, ask your doctor for liver function tests. The earlier you catch these conditions, the better your chances of reversing the damage. Have you noticed increased dryness or tingling in your hands? Drop a yes in the comments if you have. And if you're finding this helpful, hit that like button so more people can learn about these important warning signs. Itchy spot number 3, feet and ankles. Itchy feet and ankles might seem like a minor annoyance, but they could be an early warning sign of major health problems, especially as you get older. One of the biggest concerns? Poor circulation. When your blood isn't flowing properly, it can cause your skin to become dry and irritated. More importantly, it can indicate underlying heart disease. When your arteries start to narrow due to plaque buildup, your extremities, like your feet and ankles, don't get enough oxygen-rich blood. This can lead to swelling, numbness, and yes, itching. If you've also noticed cold feet, cramping, or even changes in the color of your skin, it's time to take this seriously. Then there's diabetes, one of the most common causes of nerve damage in older adults. If your blood sugar is too high for too long, it starts to damage the tiny nerves in your feet. At first, you might feel an odd tingling, a slight itch that won't go away. But over time, this nerve damage, called diabetic neuropathy, can lead to a complete loss of sensation. That means small cuts or infections go unnoticed, which can spiral into serious complications. For some, this can even lead to amputations. Imagine losing the ability to feel your own feet. Something as simple as walking can become dangerous. And of course, we can't ignore the most common cause of itchy feet, fungal infections. Athlete's foot isn't just something that happens to young people or athletes. As you get older, your immune system becomes less effective at fighting off infections. If you frequently wear shoes that don't let your feet breathe, or if your feet stay damp for too long, fungus can thrive. The result? Persistent itching, redness, peeling skin, and sometimes even painful cracks between your toes. Left untreated, the infection can spread to your toenails, making them thick, brittle, and discolored. John, a 72-year-old retiree, didn't think much of his itchy ankles. He figured it was just dry skin or maybe a mild rash. But after a few months, his legs started to swell. The itch turned into a dull ache. Finally, during a routine checkup, his doctor noticed something alarming. His circulation was dangerously poor. The blood vessels in his legs were so clogged that he was at risk of developing painful ulcers or worse, needing amputation. If he had waited any longer, his condition could have turned life-threatening. So, what can you do? First, check your legs and feet regularly. If you notice redness, swelling, or persistent itching that doesn't go away with moisturizer, take action. If you have varicose veins, those bulging, twisted veins under your skin, it could mean your circulation is already struggling. Wearing compression socks can help improve blood flow and reduce swelling. Keeping your feet elevated when you sit for long periods can also make a difference. For nerve-related itching, controlling your blood sugar is key. A balanced diet, regular exercise, and routine checkups can help prevent nerve damage before it gets worse. And if you suspect a fungal infection, keep your feet dry, wear breathable socks, and use antifungal creams or powders to stop the infection from spreading. Have you ever had unexplained foot itchiness? Let us know what worked for you in the comments. And if you're finding this information helpful, hit that like button so more people can learn how to spot these warning signs before it's too late. Itchy spot number 4, lower back and spine. You're sitting in your chair watching TV when you feel it, an itch creeping along your lower back. You reach around to scratch, but the relief is only temporary. Maybe it's just dry skin, or maybe your clothes are irritating you. But what if it's something more? What if your body is trying to tell you something serious? One of the most overlooked warning signs in older adults is persistent itching on the lower back or along the spine. It might not seem alarming at first, but in some cases, it can be an early sign of a serious health issue. One of the most common culprits? Shingles. If you had chickenpox as a child, the virus never fully left your body. It stayed hidden in your nervous system, waiting for the right moment to reactivate. And as you age, your immune system weakens, making it easier for the virus to resurface. It often starts with an odd tingling sensation or mild itching on one side of the lower back or spine. But then, small blisters appear, forming a painful rash that can last for weeks. The worst part? Even after the rash fades, some people are left with nerve pain that lingers for months or even years. Susan, 65, thought nothing of the itch on her back. It wasn't too bad, just a minor irritation. But a few days later, she noticed a burning sensation. Then, a rash appeared. She went to the doctor and was diagnosed with shingles. Luckily, she caught it early. With antiviral medication, her recovery was quicker, and she avoided the severe nerve pain that many shingle sufferers experience. But not everyone is so lucky. If you're over 60, one of the best things you can do to protect yourself is to get the shingles vaccine. It significantly lowers your risk of developing the disease, and if you do get it, the the symptoms are usually much milder. But shingles isn't the only reason your lower back might be itching. In some cases, it could be a sign of kidney disease. Your kidneys filter waste and excess fluids from your blood. But when they start to fail, toxins build up in your body, and one of the first symptoms is persistent itching, especially on the lower back. If your skin feels unusually dry, and you also experience fatigue, swelling in your legs, or changes in urination, it's time to get your kidneys checked. Liver problems can also cause itching, particularly if your body isn't producing enough bile. Bile helps break down fats in your digestive system, but when it's not flowing properly, toxins accumulate in your skin, leading to an uncomfortable itch. If your lower back itching is accompanied by yellowing of the skin or eyes, nausea, or dark urine, don't ignore it. Your liver might be struggling. So what can you do? First, pay attention to any changes in your skin. If you develop a rash, blisters, or persistent irritation, don't just assume it's dry skin. Stay hydrated to help your kidneys flush out toxins. Avoid excessive alcohol consumption, which can stress both your liver and kidneys. And most importantly, schedule regular checkups to catch any potential issues early. Shingles can be dangerous, especially as you get older. Have you or someone you know experienced it? Share your story in the comments. And if you found this information valuable, hit that like button to help others stay informed. Itchy spot number 5, chest and abdomen. Persistent itching on your chest or abdomen can sometimes be an early warning sign of major health concerns. Your body doesn't send signals like this for no reason. It's time to pay attention. One of the most overlooked causes of chest itching is liver disease. Your liver plays a crucial role in filtering out toxins, but when it's not working properly, bile can build up in your bloodstream. This excess bile can cause severe, persistent itching, especially on the chest and abdomen. If you notice yellowing of your skin or eyes, dark urine, or unexplained fatigue along with the itching, it's time to see a doctor. Another possible cause? Poor circulation due to heart disease. When your heart isn't pumping blood efficiently, it can lead to changes in your skin, causing dryness, irritation, and itching. If you've been feeling short of breath, experiencing swelling in your legs, or noticing a persistent itch that won't go away, it could be a sign that your heart needs attention. But here's something most people don't expect. Chronic itching can also be an early symptom of cancer. Lymphoma, a type of blood cancer, often causes unexplained itching due to inflammatory substances released in the body. And in some cases, pancreatic cancer can trigger excessive itching before other symptoms appear. Robert, 70, never thought much about the itch on his chest. It wasn't painful, just annoying. He tried switching soaps, applying lotion, even changing his diet, but nothing worked. Eventually, he saw his doctor, and after several tests, he received a shocking diagnosis: early-stage pancreatic cancer. Because it was caught early, treatment was successful, and today, Robert is healthy. His persistent itch was his body's way of telling him something was wrong. So, what should you do if you're dealing with chest or abdominal itching? First, don't ignore it, especially if it's persistent or getting worse. Pay attention to other symptoms like fatigue, weight loss, or skin discoloration. If something feels off, see a doctor. Your body is constantly communicating with you. These 5 itchy spots, your scalp, hands, feet, lower back, and chest, can all be warning signs of something bigger. Don't brush them off. Early detection can make all the difference. Have you ever experienced unexplained itching? Let us know in the comments. And if you found this video helpful, tap the like button and also subscribe. It helps us bring you more life-saving information.